Hi, everybody. Thanks so much for joining our webinar today. This webinar is hosted by the Gateway to Global Aging Data, and we're based out of the Center for Economic and Social Research at the University of Southern California. Today, we'll be providing an introduction to the Gateway to Global Aging Data, explaining who we are, what we do, and what we can offer to you. I'm Jenny Wilkins, and I'll be going over the first part of our presentation, and my colleague Dristan Phillips will be taking over the second half of the webinar. The webinar should last about 45 minutes with time for questions at the end, but you're also welcome to ask questions as we go, which you can do using the question and answer panel or the chat box. A recording and slides from the webinar will also be made available on our website later today or tomorrow. For this webinar, we're planning to provide some background on the HRS family of surveys, and we'll show you some of the tools the Gateway offers that will help you use this network of studies. To start, the Gateway to Global Aging Data initially began almost 20 years ago as a free public resource designed to facilitate cross-national and longitudinal studies on aging using the HRS International Network of Studies. We're grant funded by the National Institute on Aging, which also funds many of these studies because we help researchers like you use this wealth of data more quickly and accurately. The Health and Retirement Study, or HRS, began in 1992 as a nationally representative, longitudinal, and multidisciplinary survey of individuals over age 50 in the United States. As population aging has progressed in every region of the world, the remarkable success of the HRS generated substantial interest in collecting similar data in a similar manner, leading to the development of comparable surveys in 47 countries around the world. We tend to call this the HRS International Network of Studies, or the HRS Family of Studies. And this network continues to grow and expand to even more countries, providing an incredible opportunity for not only longitudinal, but also cross-country research. So what sets the HRS International Network of Studies apart from many other surveys is that they are built to be representative of the country's population of older adults. They are longitudinal, meaning they follow the same people over time, and they are multidisciplinary. So while many other surveys will focus on a single content area like economics or health, these surveys cover not only health and economics, but also family dynamics, psychosocial measures, and so much more, including the integration of biomarkers through physical measurements and DNA collection. These studies have also worked to coordinate their survey instruments and to enhance the quality of their economic data. Importantly, they all release publicly available data that is open to researchers around the world for free. From the chart, you can begin to see the other countries and studies that have developed following the HRS, from Mexico to many countries in Europe and Japan, South Korea and China, among others, many of which have collected data for more than a decade, and others that have only conducted a single interview wave so far. As I mentioned, the HRS family of studies are multidisciplinary. Here are just a few examples of the many topics covered by these surveys, ranging from demographics, health and healthcare services, to work and employment, economic status, and family structure. Because we know it can be difficult starting to learn about one of these surveys, let alone several of them, we've created the Gateway to Global Aging Data at g2aging.org as a centralized resource to help you learn all about these studies. So what exactly does that mean? First, we provide a ton of information about the HRS family of studies, including information about the studies themselves, about their specific questions and questionnaires, and question comparisons between studies and over time. Second, we produce harmonized data for an increasing number of these studies. I'll explain harmonized data in a little more detail later, but basically it takes a subset of the original survey data and creates new research-ready variables that are defined as similarly as possible across waves and across studies. We also provide some handy tools for using our harmonized data. Third, we've developed a policy explorer so you can gain a better understanding of the policy environment in place at a given time, which can provide insight for your research. We also provide a publication search based on the HRS family of studies, as well as additional resources, like this webinar today. So if you were to go to our website, on the Health and Retirement Studies overview page, you would find a little information about the family of studies and a list of the study names, acronyms, countries, and the year it started. If you click on any of the study acronyms, we'll be looking at our study overviews. So here's an example for the HRS. First, you'll find a link to the cohort profile paper and a small paragraph that introduces the study's sampling framework. We also list out some helpful information, including age eligibility, the number of people interviewed, and so on. Then under the Data Collection tab, we highlight the timing of the core interview collection periods, as well as providing some information on the other types of surveys that are fielded as part of the study. As you can see, the HRS has conducted many other types of surveys. Under the Sample tab, we provide information on the refreshment samples that occur, and we highlight participation by interview wave for each cohort. And then this isn't shown on the slide, but under the Data Linkages tab, we also list the types of administrative linkages included in the study. Then under Data Access, we provide the links you need to obtain all available study data, including any restricted data a study might have. And under Harmonized datasets, we provide the links you need to find the harmonized versions of the study data. So now that you've read about the study itself, we can talk about the Health and Retirement Studies questionnaires page and jump right into the survey questionnaires. Here we provide detailed information about the different parts of the survey. This page is for the core or main interview, but we also have this information available for the end-of-life interview that takes place when a respondent has passed away, the life history interview, which collects detailed information about the respondent's early life, the health assessment and self-completion questionnaires, which are usually tied to the core interview, and also the HCAP interviews, which stands for Harmonized Cognitive Assessment Protocol and is an in-depth cognitive interview. So if we were to click on any of these, we'll say HRS Wave 14, then it includes the order of modules and the order of questions within modules. And if you click on one of the questions, let's say C005 in the physical health module, then it will look kind of like this, and we can see question text, any applicable interviewer prompts, as well as answer types and choices and how they're formatted. Doing it this way can be a little bit tedious, but it gives a good general overview. But chances are you probably already have a topic that you're interested in. So that's where our questionnaire search comes in really handy. So you can type in a keyword that you're interested in and even limit the results to a study, year, survey type, survey, or module. So let's say you're interested in questions about smoking. If we type smoked into the keyword box and search, all questions with that keyword will show up. So here we've limited it to the HRS. So we're seeing a whole list of HRS questions concerning smoking. If you click on any of the questions on the left, you can read that particular question text. So let's say you found the question you're interested in and are now wondering whether it's asked the same between studies. Then you'll want to look at our question concordance. This highlights the availability and comparability of survey questions over time and between studies for select topics. Under the health, domain, and vision topic, we can see 4 questions related to self-reported eyesight and wearing glasses. If you're only interested in one of these questions, you can actually X out of some or select the question you want from the drop-down menu so that this table is a little easier to read. Then you can pretty easily see what studies and interview waves the questions are asked in and any potential difference in original answer scales. If you want to get even more in depth, you can download our domain-specific user guides, which summarize how different research domains were collected across the HRS studies and provide expert opinions on their comparability. We have them for a wide variety of topics, and we're currently working on updating many of them. Finally, under the HRS Studies Get Data tab, we provide the links where you can download the original survey data. Survey data files are almost always distributed by the originating study, but there are a few that are directly distributed by the gateway. We also provide data access instructions with the steps you would need to follow in order to successfully download the data. So now we'll start talking about harmonized data. As I briefly explained before, harmonized datasets are created to provide research-ready variables that are defined to be as comparable as possible across waves and studies. One harmonized dataset is created for the data for each study. They are longitudinal and incorporate all available waves and are set up so that each individual is one record or row. Variables are built with an intuitive naming convention. For example, R1 work indicates whether the respondent is working in wave 1. We also create spouse versions of most variables, so you could study how something impacts both members of a couple. While ideally every variable is comparable over time or across studies, there are instances in which question wording or cultural differences render measures similar but not strictly comparable, in which case we'll provide a study-specific variable name using an underscore and the first letter or two of the study. For example, R1 LBRF underscore E indicates the respondent's labor force status in wave 1 of ELSA, the English study, but it uses a different response scale than the one used in the HRS. Finally, harmonized variables have been built to account for any survey skip pattern. Here's a pretty simple example of accounting for survey skip patterns to create a harmonized variable. We want to create R1 smoke ev, which indicates whether the respondent has ever smoked in wave 1, with a 0 meaning that the respondent has never smoked and a 1 meaning the respondent has ever smoked. So the share first asks whether the respondent has ever smoked, and if so, then they are asked whether they smoke now. While ELSI, which is a comparable study in Brazil, first asks if they currently smoke, and if not, then if they ever smoked. So we account for these differences when we create R1 smoke ev and all of our other and even more complicated harmonized variables. So here's an example of a more complicated harmonized variable. In order to get an accurate measure of household savings in wave 1 of JSTAR, the Japanese study, we have to take into account a series of questions from both the main interview or CAPI, as well as the self-completion questionnaire. This sort of highlights how much time our harmonized datasets can save you in getting started, as well as minimizing the risk of mistakes along the way. Along with each harmonized dataset we create, we also provide an accompanying codebook. We provide a brief introduction to the harmonization project and study, go over survey timing, design, and sampling, provide some information on weighting and any imputations, and divide variables into sections based on research domain. We summarize each set of variables, showing the counts of each answer option for categorical variables, and providing the summary statistics for continuous variables. We also detail exactly how we created the variable and explain any assumptions we might have made in its creation. We also highlight any differences between waves, as well as any differences between this variable and the HRS version of the harmonized variable. And finally, we list all the variables from the originating dataset that were used in the creation of the harmonized variable. We do all of this to be as transparent as possible so you can feel comfortable using this data. So the Gateway has already released harmonized core data files for 11 different HRS family studies. There are actually 2 user-friendly data files for the HRS. The first was the RAND HRS longitudinal file produced by the RAND Corporation, and it includes many different helpful variables. Then there's the harmonized HRS, which was built by us at the Gateway and can be viewed as a complement to the RAND HRS because it includes a whole new set of variables for the HRS. But we also create data sets that are comparable to the combination of the RAND HRS longitudinal file and the harmonized HRS for Mexico, England, Europe, Costa Rica, South Korea, Japan, Ireland, China, India, and Malaysia. We'll be working on adding recently available waves of data for several of these harmonized datasets this year, as well as creating harmonized datasets for Chile, Brazil, and Northern Ireland. In addition to the core, we also create harmonized end-of-life data files. These are built from the end-of-life interviews conducted with a close relative or friend after the respondent's death, and they include information about the circumstances of death and the disposition of assets. We currently have harmonized end-of-life datasets for the US, Mexico, England, Europe, South Korea, and China, and the one for Japan is in production. We also build harmonized life history data files. So these are built from the life history interviews in which the respondent provides retrospective reports about their entire life, covering their childhood, education, jobs, family situation, and health. Unlike our other harmonized data sets, these are built in a user-friendly sequence format. Harmonized life history data has been released for England, Europe, and China, and is in production for South Korea and the US. Then there's the HCAP, or Harmonized Cognitive Assessment Protocol. So these interviews measure a range of cognitive domains affected by cognitive aging and allow for comparisons between populations around the world. Harmonized HCAP files have been built for Mexico, England, and India, with the US coming soon and Chile in production. These harmonized files include sophisticated cognitive imputations and latent variables. Lastly, we have harmonized COVID data files. Many of these surveys fielded special COVID-19 interviews in response to the global pandemic. They provide more immediate information on the impact of the pandemic and include questions on a wide range of topics. We've released harmonized COVID data files for the US, England, and Europe, and have been building one for Ireland. So now that we've gone over what harmonized datasets are and which ones have been made, I'll hand it over to my colleague Tristan to show you the rest of what our website offers.
Thanks so much for that, Jenny. All right, so now that Jenny has given us kind of a nice overview of, what is a harmonized data set, what's a documentation, I'm going to kind of go back to the website, the Gateway to Global Aging Data, and kind of give you more information about, so how do I find these harmonized variables that might be helpful in this data set? So one tool that we've built for that is the harmonized variable search. So you can search for harmonized variables using a keyword, and you can limit it by study and by year or by survey type. And those survey types mean things like core or HCAP or end of life that Jenny just talked about. You can see here in this example, we've searched for the word smoking across all studies. And you can see that there's many versions of this variable. Here we highlight some from CLOSA, HRS, and MHAS. That's the South Korea and the United States and the Mexican studies. And we have information about the age started smoking, age quit smoking across these different data sets. And you can also see kind of again, our variable naming conventions. So that first variable listed, R8 start smoke, is for the respondent, that's R wave 8, when they started smoking. We've also built a variable concordance in case you already kind of have a topic in mind and you don't want to search for a keyword, or maybe a keyword isn't exactly the right way to find the variable you're looking for. So using the harmonized variable concordance, you can see the availability and comparability of harmonized variables for selected topics. In this example here, you can see that we've gone to the topic of health and looking at self-reported health. And you get this note here at the top, which is really helpful, which says, for self-reported health, there's one variable called SHLT, and that's the respondent's self-reported general health status, ranging from excellent to poor. And then there's another harmonized variable called SHLTA, and that's the respondent's self-reported general health status. But this one uses a scale ranging from very good to very bad. So there's kind of two different scales that have been used. Often this first scale, excellent to poor, is used. It started, I think, my understanding, it started being asked in the US, but many European countries have tended to embrace this other more symmetric scale going from very good to very bad. And then you can see the variable names, the descriptions, and then the data set where you would find this. And this data set is quite helpful because, for instance, you can see here for the first variable that this is in the RAND HRS longitudinal file, and we have it there for waves 1 through 15. Jenny mentioned that there's a RAND HRS longitudinal file and a harmonized HRS file. So this tool will kind of give you an idea of where you should look for those variables, especially with the HRS. You'll also notice that some studies actually ask both of these. So if you look at harmonized ELSA, you can see that they used this first scale from waves 1 through 9, but they also used the other scale from waves at waves 1 and 3. So there's some comparability there and there's some overlap there. So this is kind of a nice way to find variables for certain topics, not all topics, that we've built harmonized variables for. And then building off these harmonized variables, we've also developed a kind of a graphs, tables, and maps function as part of the Gateway website. And we did this because we kind of wanted to, give researchers and users the ability to kind of see what this data looks like before, going through and downloading the data themselves and pulling it together and thinking about survey weighting. So we built this kind of graphing tool to really give you an idea of kind of the scope and the breadth of some of our harmonized data. So currently you can select from over 100 topics, 29 countries, and 13 different years. You can also filter your statistics at the individual level or household level results. These are also population estimates. So we've already gone through and kind of applied the weighting that's necessary that you often want to take into account when using these survey data. It doesn't require that you've already downloaded the data, and you can view them as graphs, tables, or maps. And then you could download any of these for yourselves. You can see here on this example on the right, what we're comparing is self-reported poor health. So that's being in the poor, answering poor to your self-reported health, and it's looking between England and the United States over 2 years, so over 2016 and 2018. So we could, if there's a 2-year trend there, we could see that. And then we've also kind of subset this by education level. And we kind of, as part of the harmonized data, we've developed these like internationally comparable education variables, with kind of guidelines that are developed by UNESCO to compare education. So you can see that we have less than high school education, with high school or vocational education, and with college education. And what you can really see is kind of between these two countries, there's like a very similar pattern, which is that people with a higher education in general have lower reports of poor health. But you can also see the gradient is kind of different between them. It certainly looks like that in the United States, there's a bigger gap. There's a bigger association, especially between people with less than high school education and with high school education, and in association with self-reported health. And then, of course, we have some notes about where we got these and the weights that we used. Another function that we built in is that we wanted to kind of add some contextual information. So we've added some kind of like macro level or country level statistics that might help you kind of understand the survey data that we're seeing. So on the left here, this is the United States. This is kind of individual earnings between 1996 and 2014. And we've divided this again by people with less than high school education, or vocational, and with college education. And we're only looking at people aged 50 to 59 in this graph. So these are kind of people we would generally expect to be of working age. And one of the things that you can see is that over time, we kind of see this like increase that's happened, particularly for people with a college education over time, and their increase in real earnings. So this is one of the things that we're doing in the background here is that as soon as you are asking for a financial variable over different time periods, we already go ahead and make sure that it's in real terms. In this case, we're using 2010 US dollars. And then we kind of compare that side by side with US GDP per capita. And you can see that over this whole time range, that GDP per capita has been basically increasing. There was, of course, a slight dip in 2009 here with the recession, but overall, it's kind of an increasing trend. But one of the things that we see is that that increasing trend is really only reflected, or primarily reflected, with people with a college education when looking at survey data. So with this kind of contextual data, and I'll talk more about this, we're hoping to add to our understanding of, what we're observing in this survey data by understanding, what's the context of people, what's the institutional, financial environments, the cultural environments in which they live in. And speaking of institutional environments, so one of the things that we built is a policy explorer. And this allows researchers to understand the policies in place at the time of the survey. So what our team has done through a lot of work is that we've collected policies, different policies, and we've indexed them by country and by year. And so currently the Explorer is focused on retirement policies and long-term care policies. We have retirement policies, which generally means kind of like pension policies. You can see an example of that here on the right. We have that available for 15 countries. And we have currently long-term care policies available for 9 countries. And also in the United States, because these policies are basically at the state level, we have it for 14 states. Over the next few years, we're adding more countries and states. And really the overarching goal is that we would be able to have index policies for all of the countries that have an HRS study. We're also in the process of collecting and making additional educational policies. So you can kind of see here on the right, again, these are the retirement policies or pension policies that we have as part of the platform. So we've collected basically how much you would get of your own public pension benefit, your spousal public benefit, survivor public benefit, old age social assistance, and public old age health insurance benefit. And you can already see just from this example here that there are some differences. So for instance, in Poland, there is no spousal benefit. While in other countries, this is like quite an important component that a spouse of a primary worker is able to receive kind of their own benefit based on their spouse's work. If they didn't accrue enough in Poland, they don't have this plan, the part of this plan. So part of really the goal, the overarching goal of this whole HRS International Network of Studies is to think about how policies influence and affect people's lives and people's aging. And I think this Policy Explorer really starts to get to being able to answer that question. For each of the policies that we collect like a full set of detailed policies for each country. And we also distribute these kind of as standalone documents, which includes detailed tables and formulas. So this is for Italy. This is the Italian Public Old Age Social Assistance Plan details. And you can see here that we have a table and a formula, and this is the monthly payments that are paid out per year, and then the formula that derives how much supplemental benefits are paid. Because we really spend a lot of time collecting these to the point that what we want to be able to do is really to think about the people in the survey and be able to link them like exactly to, in this case, like their pension generosity. If this person retires, how much pension could they expect at that time? Would it be discounted from their full pension, or would it be a fuller amount if they wait until longer, for instance? And so that's really the goal of this project. As Jenny mentioned at the beginning, we've also built a kind of publications index based on publications that are using HRS survey data. And this kind of like works similarly to Google Scholar or PubMed. The difference is that basically only publications that have used HRS data are included in our publication search. So you can select from study, topic, year. You can also find a keyword, and you can find links to all of the papers You can see an example here where the topic is, you set the topic of cognition. And one of the things that we're telling you is for this first paper, this uses tilde data. That's the Irish data set. And then for the next one, it's using ELSA and tilde. So it's using a kind of cross-study analysis between these two. And this linkage is really quite helpful. And this is, I think, what the publications is able to offer over a more general publication search. Because often in the the kind of the title or the abstract, they're not going to say what data set they use, right? You might actually have to read through the methods or data section to figure out which data they're using. So we've kind of done that work for you and tagged these. There is, I would say, a slower lag. I think we try to update these around every 6 months, but for the newest papers, it probably wouldn't yet be on our publication search. But I really think it's an invaluable service, particularly because, the first thing that you want to do when you think about, you're envisioning writing a paper using this data is you want to see what other people have already done, both to make sure you're not duplicating what's already been done, but also because you kind of want to think about like how this research space that you're approaching, how have other people already thought about that? And I think it's a really helpful tool for that. We have some additional resources that include upcoming past webinars and presentations. This webinar today will be posted on there within the next 24 hours. We have announcements and data updates, and we also have some informational blogs. To obtain the harmonized data, generally, as Jenny said, the gateway doesn't distribute data itself. So harmonized data files are either distributed through the gateway or by the originating study. There are a few cases where the data files are created by users based on code provided by the gateway. So that's true for SHARE, the European study, and for CLOSA, the South Korean study. So in this case, what happens is you would download their data, and then from the gateway, you would obtain a kind of a long Stata program that you could just run once, and it's going to create the harmonized version of that data for you. For all of these other cases, you'll be able to download them directly from the websites that are linked here. And in all cases, we have data access instructions and harmonized codebooks that are available. One of our kind of newest things that we've been building is a couple different subsites to think about the different kinds of data that are collected. You can see here, this is our soon-to-be published Gateway to Global Aging Data COVID website. That'll be at covid.g2aging.org. And because all of these studies fielded COVID interviews, we wanted kind of a portion of the website or a space on the website that was really devoted to understanding these particular surveys and the dynamics of these surveys. So we've built that you can go ahead and check out. Similarly, because we're trying to understand the environments and contexts that people are living in, we've also developed, with funding through the NIA, an exposome portion of the gateway. And so this really focuses on kind of people's environmental exposures, thinking about pollution, light pollution, access to green space. And what we've been able to do for some studies is actually map to where the respondents who were interviewed, where they live, and maybe make calculations of their exposure to different kinds of pollution. And then you can really think about how these exposures are changing people's experiences and trajectories of aging. I'm sure we all know that there's seems to be very strong links between exposure to pollution, certain pollutants, and cognition. And in aging, cognition and dementia prevalence is something that we think about a lot. So this is a very exciting development. We also have a data enclave that just recently been launched in the last few months. So if, for instance, you didn't want to go to each of these websites and download the data themselves, what we've done with the NIA is we basically created an enclave that you can register for. This is through the NIA's linkage platform. And you can get access to all these data kind of on a virtual desktop that would be yours, and you could save files on there. And in this case, we're kind of providing you this provides access to Stata and R already. Currently, you can see here the studies that we have listed. We don't have all of the studies data yet, as we're working to obtain those permissions, but we have HRS, ELSA, and LASI on there currently. The one thing I'll just mention, which you see here at the blue at the top, is that because of a restriction currently on the linkage platform, only people who are in the United States can register to use this. So this is not a great solution for international users. Although, as Ginny said at the beginning, all of these studies allow the international research community to download the data and use it on their own platform. But it just takes going to each site and getting different clearances. The advantage here is that you can sign into the enclave and you get one clearance. We do ask that you could register on the gateway if you're interested in using it and staying in touch with us. To do that, you just click on this kind of like person icon at the top of the gateway website, and it's a very simple process. Basically, we just want to know your name, country, email, and institutional affiliation. And then you can also sign up for alerts or announcements through the gateway kind of email list that would say like, hey, we've got a new version of this data set that's just been developed, or we're hosting another webinar coming up, things like that you can find there. If you do use the gateway or the harmonized data in your research, we just ask that you include this citation in your research. This helps us understand how people are using the gateway and helps our funders know that like lots of great research is being done using the resources provided and developed by the gateway. We do have one soon upcoming additional webinar, and that's the Introduction to the Gateway's Retirement Policy Series and Contextual Retirement Variables. That's on May 22nd, 9 a.m. in LA, noon in New York, and 5 in London. You can register at this link here. Also, these slides will be put on the Gateway in the presentations page, so you can also click on these links once those are put up there. And then we'll also have an introduction to the Gateway to Global Aging Data Enclave. We haven't set that webinar date yet, but we're thinking mid-July, and that will basically coincide with a call for papers for a workshop that we're hosting as part of the Gerontological Society of America's annual conference, which takes place in November in Seattle. And if you're accepted to that, we would pay for your kind of additional stay for another night in Seattle, and you can come present and get feedback on the work that you've done using the HRS study data, harmonized data sets, for instance, particularly using the enclave. So I do encourage you, I hope you've been encouraged to use our platform through this for your research. I think it's a really nice tool that contains really like a really great breadth of types of data and data from different disciplines, but also is like we've really tried to think about how to make it quite accessible and understandable. We do have a help desk, so if you have any questions about how to use the gateway or how to get access to this data set, or trying to understand a harmonized data set, you can always email us. Our email address is help@g2aging.org, and that email goes to kind of a whole team of people who work on the gateway to answer. And then I'd also suggest if you have some topics you're interested in, you could check on our presentations page and find if there's older presentations that would be of interest to you on your topics, and then also check out our blog. So thank you so much for joining us today. And I think Ginny and I are happy to answer any questions if you have them right now. I see that we have one hand up, which is Eric. And Eric, if you would like to, I'll allow you to talk if you would like to say your question out loud. And for anyone else, you can also use the chat or the question and answers function, and Ginny and I will stay around and answer questions for you.
Okay, can you hear me?
Yes, we can.
Oh, okay. Yeah, I bunch of little question. Oh, that about the just a quick. This wasn't my main question, but about the GSA and the extra day. Are we going to get? Can we get? Is there some email going to be sent by GSA or the mailing list about that?
Yeah, I think that we will. Our plan is currently we would send an email out through GSA, but if you are also registered on the gateway, we would be sending out one too, kind of because we assume
Okay.
it's using our platform, so
Yeah.
most of the users would already be using it and would be registered there.
Okay, I'll be
Yes.
on that. I just wanted to know if you're, and in a way this is personal, but then also it actually could apply to other things. If you're, I don't know, I know it's probably complicated bureaucracy policy about the funding, about who's paying, and helping these different countries with different things. And I say this because I don't know if you know, and it was weird timing because I was in Ireland at the time, but the tilde has really restricted Americans like there, I was actually there. Like it was the worst timing because I could have downloaded it like 3 months before I got there, and I was like in there, and I was affiliated with Irish University, and they're basically like, we're not going to give you the restricted, and they basically also scrubbed. They scrubbed a from ICPSR that was already taking identifiable data. Like it wasn't. There's nothing identifiable on ICPSR, and they scrubbed that too, and they're like, we don't want Americans using our data. Period. Bye. And I was also
Yes.
working with an Irish colleague. So it just kind of made me, because I think we're funding part of that. And it didn't make any sense. I don't know why ICPSR would even listen to, but anyway, do you have any thoughts about that? Or what's to stop other countries from doing this, especially since they
Mhm.
can use our data? And I do understand we have more, I guess, liberal policy, right, in the US.
Yeah, exactly. So you are completely right on the current situation with the tilde data. And I speak to the tilde team frequently. They are also unhappy with the situation because they really also they want their data to be accessed and used. Ireland passed like a very strict data privacy law that basically doesn't allow any personal data to be transported or accessed even through an enclave outside of Ireland right now. So they're trying, but there's been a ton of pushback, especially from the research community about this rule because, like, of course, the tilde team, the tilde was designed to be comparable to all these other studies. So it's a very strong restriction that no other country has had that kind of legislation before. So we are working on them with it, and they're working on it. I don't know of any timeline though for when it'll be
I
available.
do
Jenny, you can jump
actually,
in.
sorry, I do think there was movement on this because I happened to check their website last week through ISSDA. And there has been a change on their webpage where it no longer says that tilde data is not currently downloadable. So it may in fact be downloadable. I don't know if it is restricted to particular countries at this point. But it does look like there has been some kind of movement towards becoming available.
Yeah, I hope that answered your question, Eric. Okay, and Eugene, I can see that you also have a question. I will unmute you.
All right. Thanks a lot, Tristan and Jenny. This was terrific. Two quick questions. So one is about data access to through enclave. Do you think that like private sector affiliation would make it more difficult, or is there anything there, I guess? And then the second one, a little bit off topic, but I worked a lot with the RAND HRS,
Mm.
and I know that they do imputation on a lot of like wealth related. Do you guys do that as well, and in the similar fashion in your harmonized version, or is that closer to the original HRS?
I think I can take these two. To the first question, yes, I do think if you have private affiliation, you would not be able to use the enclave. I think and I should say by private, meaning like for profit. If the
Mm.
aims of your research are for profit, you could not use the enclave. And actually, many of the studies, not all of them, but many of them require that you're not using the data sets for profit. Any kind of for-profit advancement, you have to be it has to be research focused. Not all of them, but I wouldn't say most or half or something, but some of them
But
have that restriction. Yes.
so a quick question on this is, would the private sector affiliation kill that automatically, or if it's still kind of research and purpose that will be published and is not for, or just the fact that it's a for-profit institution that kind of assumes that everything, one does is advancing that purpose?
Yeah, I mean, how that has been judged so far has been by institution. So, yeah, if you have to include your institutional affiliation, and if that was a for-profit organization, then yes, I think that would kill it. That's
Okay.
true.
And
Certainly. Your second question about the RAND HRS and financial imputation. So yes, they've done a lot of that. Many of the other studies actually also do their own imputations. So in the case of the HRS, RAND does a lot of the imputations for the HRS, but many of the other studies have like taken on that kind of burden themselves. So they've done their own imputations. I will say they're not. One of the things is because it's not done by the same organization, they're not imputed in the same way. But I would say, having reviewed them, like they're all generally trying to do something similar and allowing you to fill in item level missingness in a way that replaces what would thought of be as the true distribution, so that people don't get dropped in kind of a complete case analysis version of a regression technique. For some studies that don't, we do our own imputations. For any study that doesn't, that we have a harmonized data set for, I think this is currently true. We've also done our own financial imputations. I think the exception is currently the harmonized Charles. It has not. We have done imputations, but we're in the process of reviewing them, and they haven't been released yet on the Charles website. But yeah, that's something we've thought about and tried to address.
Hey, thank you.
Certainly. Thanks for the question. Eric, did you have another question?
Sorry, I dropped there for a second. Yeah, one thing I think could be helpful for everybody is just to maybe give us some like a quick 2-minute advice about if we were going to use a data set for the first time, let's just say MHATs or whatever, should we use the harmonized as like or the non-harmonized as a first choice, and does it depends if the variables are harmonized, right, or if we definitely want to do a comparison or not comparison, more of like a strategy the first time we're using and we have an option to use harmonized or not? Thank you.
You want me to take it?
Yeah, I think you can.
Okay, so obviously we're a little bit skewed because we're going to say, yes, I think it's a good idea to use the harmonized data. So I'll give you sort of an example. Many studies, they will release data by wave, and they're often divided into multiple data sets based on different portions of the survey questionnaire. So for like a single data set, a single wave of an interview, you're talking, 5 to 20 different data sets that you have to find the questions you're interested in. Versus the harmonized data set, which will have a good number of those variables all together in one place, with a little bit more documentation to explain everything. And then if you are using a harmonized data set and then there's a question that's asked that we have not produced a harmonized variable for, then it's really quite easy to merge that data in, so you can sort of create your own version of a harmonized variable based on that topic that you're interested in, and then use that for your analysis. Did that sort of cover it?
Yes, so yeah, thank you for that.
Yeah, I think maybe just to add on, I think, the harmonized data sets don't contain everything, but what we've tried to do is like put those things in that are like most consistent and most frequently used by the research community, most consistently asked across the studies and most frequently used by the research community. But for instance, there's lots of variables which aren't, and depending on what you're looking at, you might have to bring in some raw variables. But I guess my strategy I would always say bring in the raw variables into the harmonized data set, because that's going to have there you're kind of already thinking about what's happened longitudinally, and you have all this kind of like subset of like variables that you would inevitably, I would assume, end up using: demographic variables, health variables, things like that.
And I think that's what I've done with RAND, right? I've used the RAND. And
Exactly.
Can you
Yeah.
state one more time, and maybe I think this would help other people. So for RAND HRS, and now we're just focusing on the US, I know there's the FAT files, there's the raw ones, and then there's the so there is the RAND version and the harmonized, and then there's one together. harmonized and RAND? No. Okay.
So no, they're completely separate data products. The RAND HRS longitudinal file is their like harmonized data set. They also have the RAND HRS family file. And so that's another version of a harmonized data set focusing on the family data. The RAND HRS FAT files they take the raw data and sort of merge across for a particular wave. So you have one data set with the respondent level data, but not the household level data for each particular interview wave. So the harmonized HRS is our version of harmonized data for the RAND HRS. And that basically came about because the RAND HRS, they have a ton of variables, but we actually wanted to expand our own data so that we were covering more topics. And so we sort of created the harmonized HRS as like an add-on to the RAND HRS so that we had a point of comparison for all the other studies and data sets that we're working on.
Okay. So the harmonized HRS is the RAND HRS that you then modified and added things to.
It's
No.
not modified. They're entirely separate. We try to cover different topics.
Oh, I see. Okay.
There is a little bit of overlap at this point, but primarily they have entirely separate content. If you actually go to our presentations page, we had a harmonized HRS, RAND HRS webinar maybe in 2022 that really dives into that in a little more detail.
Okay, thank you.
And we also had yeah, you just had the webinar, right?
Yes.
Thank you. Thanks, Jenny. Additional questions. Also, if you don't want to talk out loud, yeah, you feel free to use the chat or question and answer function of Zoom webinar.
And again, if you develop any questions later after you have had a chance to sort of digest everything, you are welcome to email our help desk at help@g2aging.org. Tristan and I are two of the few people who answer all of those emails. So.
All right, I think we can wrap it up. Thank you, everyone, for joining. Thanks for Jenny too, for starting us off today. We'll have the slides and the recording of this webinar posted on the Gateway. So if you wanted to come back and see it or share with any colleagues, that will be available for you. But thanks for joining us, and I hope you all have a great rest of the day.